So happy to have everyone. Good morning. Sorry. Welcome everyone and Happy New Year. Welcome to the Leading Age Virginia member call. Today we are going to be having several speakers. Next slide. Today we have joining us Lee Burke, the licensing administrator with the Central Licensing Office with the Department of Social Services. And she is going to be discussing with us a new infection control and prevention grant that the department received and is going to be implementing into adult services licensed agent organizations, adult day and assisted living. For today, we are primarily focusing on assisted living. Then Janine Fink Boyle is joining us, Vice President of Regulatory Affairs with Leading Age National, to talk with us about the CMS final rule and CDC revised guidance. And then we know everyone is really experiencing a tough time with Omicron. So we have invited the Department of Health to join us today so we can talk about some of your needs during this time to see how the department can support you all. So I am on November 15th, the Department of Social Services announced the receipt of a grant in partnership with the Department of Health to provide infection prevention and control support to licensed adult providers throughout Virginia. And as I mentioned, Lee Burke has joined us today and is going to be focusing on the assisted living level of care and how this grant will impact you all. So thank you so much for joining us today. And over to you, Lee.
Good morning, everyone. Thank you so much for the invitation. We're excited to share some information about this grant. Sorry, I'm trying to get my camera straight here. Just as a starter, of course, the mission of Virginia Department of Social Services is to design and deliver high quality human services that help Virginians achieve safety, independence, and overall well-being. And our vision is a Commonwealth in which all Virginians have the resources and services they need to shape strong futures for themselves, their families, and their communities. So, as you stated, Division of Licensing Programs received the ELC grant, which is what we call for short, Epidemiology and Laboratory Capacity for Prevention and Control of Emerging Infectious Diseases Cooperative Agreement, which is why we call it ELC, so we don't have to say that every time. The purpose of this grant is to provide infection prevention and control and support to licensed adult facilities, both assisted living and adult daycare centers. The goals we have are to create an infection prevention control team, to develop a comprehensive infection control training program, and to develop an online portal through Virginia Healthcare Alerting and Status System. The VHAS system, we're not going to really discuss the VHAS system too much today because we're still have to apply for funding for that piece, but that is one of the goals, so I did want to mention it. So I wanted to discuss a little bit of the methodology of how we're doing this grant. The first thing we're doing is we're sending out surveys regarding infection prevention and control. Of course, the assisted living survey went out last week. On the 30th, it included a flyer to be posted for all staff with a QR code so that staff can walk by the break room, any non-resident areas, they can scan the QR code with their phone and take the survey. In confidence, we are not asking for any facility information either through the survey link or the QR code other than regional location. And we're doing that, intentionally so that all of the information that we receive can be anonymous as possible. So, as stated on the slide, the purpose is to confidentially collect information from all staff members regarding their knowledge of infection control practices and facility practices as well. So we're really asking that you do post this flyer in your facilities so we can get as much information as possible. And we typically get a lot of information from administrators or directors of nursing when we send these links out and these surveys, but we don't often get information from individuals on the floor. And we're looking for information from all departments, not just nursing staff. We're interested in dietary staff and housekeeping and maintenance and concierge service and anyone that works in the facility. We're interested in feedback regarding infection prevention and control practices. Also in that memo, we requested that facilities send us, through the IPCT email that we provided in the memo, documents pertaining to infection prevention and control. So infection control plans, any other policies and procedures that were developed prior to COVID, during the COVID, currently, that pertain to either COVID-19 or any infectious and communicable diseases that may arise in the facility. And what we're going to do is with these documents, and we're going to evaluate them, of course, for compliance, particularly pertaining to infection control plan. But what we're really looking at is best practices. So what we want to know is, are you meeting the minimum standard, but does your facility address best practices in terms of infection control? And we're going to provide you feedback on how to make your infection prevention plan and any other policies you submit better, not only for the protection of your residents, but for your staff as well. Thank you. So once we have onboarded all of these infection prevention and control team, we're going to be scheduling on-site assessments. These are going to be pretty thorough assessments. And it's going to be a 3-part. It's very similar to the nursing home on-site assessment that is used. So we'll send a pre-assessment questionnaire. We'll do a pre-assessment interview, either over the phone prior to arrival or as soon as we arrive for the on-site assessment. And then we'll do a tour of building and grounds to observe infection prevention and control, interview with the staff member, perhaps various individuals within your setting. And we may go out to assist if a complaint is received regarding infection control. I want to provide clarification that if this is done, the role of this IPCT member will not be regulatory. It will be to answer infection control questions that the inspector may have, but it will not be with the intent that this IPCT member will assist in non-compliance. So it's more of an education opportunity for the inspectors as well to answer any questions that they may have. And as a result of all of this information that we're collecting, each facility will receive a report summarizing what the data that we collected in the survey, what we observed in the on-site assessments, what we found in the documents that we reviewed, and provide recommendations for improvement across the board. Also, once we do our initial assessment, we're going to come back and do another assessment. The goal would be after the first quarter date from the first assessment. From this point, we're going to consider which facilities may be considered high risk. The facilities that are considered more high risk after the second on-site assessment will get more on-site assessments, more recommendations to really try and bring them up to speed with best practices regarding infection control. And all of this information, again, is going to be distributed to VCU Department of Gerontology, which is assisting us in putting together a training program. It will be a tiered approach. We're really trying to do training very similar to the SPICE program, and also what VCU Health is putting together in terms of their grant funds. So it'll be a tiered approach with basic information, intermediate level, and advanced level regarding infection control practices. The training is going to be available for all departments and all roles. I know a lot of times we generally see training, it's focused on the nursing department and ALFs, but infection control is equally as important for dietary, housekeeping, maintenance. Everyone has to be engaging in excellent infection control practices to reduce the spread of any type of communicable disease. Okay, we're also going to focus on, supervisors, and that's various levels. That could be RNs, LPNs, registered medication aides supervisors, direct care staff supervisors, to help them and how to model appropriate infection control protocols, how to properly supervise. I'll tell you, one of the things that we're seeing in Central is inspectors are going out, and there's still a significant number of staff members that are not wearing masks, or they pull the masks up when we walk by. I observed that myself a few weeks ago in a facility. So there still seems to be some struggle with understanding the importance of wearing masks in these settings. So we're going to focus on that as well. And the trainings are going to be virtual. They're going to be self-study. They could potentially be in person. And of course, like most any other trainings, you have to complete the quiz at the end in order to receive credit for your training. Next slide, please. Oh, that was it. So I want to stress that the whole mission of this grant is to improve infection control practices. It is not going to be punitive in nature. So we're really asking you to send us these documents that we requested in the memo, to post these flyers so that we can really get a true idea of what people's perspectives are on infection control practices, because we can't help if we don't know it. So we're not going to review an infection control plan and then send you a violation notice because it's out of compliance. The whole purpose of the grant is to bring the facilities that may not be in compliance into compliance, and to provide information on best practices. So, we really want to stress that this is not going to be something punitive, and that we can't do it without you. So if we're not getting the surveys completed from all levels of staff in assisted living facility, if we're not getting the documents, I can tell you I've received documents from 2 facilities. The memo went out on the 30th, and I received 2 from the Piedmont region, and that's it at this point. So, we're really asking that your participation is critical in the success of the goal of the grant.
Lee, thank you so much. We have a couple of questions. Will this survey that was sent out for assisted living, will there also be one that's going to be specific to adult day?
Yes. Yes, and that is actually in its final stages right now. It's going through its vetting process where we send it to various different people and get feedback. It will mimic the one that went out for ALFs for data collection and analysis purposes. Minus changing the terminology that's not applicable to ADCs that's in the ALF, and perhaps some regulatory things as well. So everything that we're going to do in the ALFs, we're going to do in the ADCs as well.
And based on all that you've said, it sounds like that this is really supposed to be a support system to assisted livings, and that they should embrace it, that there's nothing punitive, nothing about this process could trigger a survey. Is that correct?
Right. So we're not going to collect this data and then turn around and send an inspector to your facility. And that's why I'm most appreciative that you asked me to be on the call today, because that's one of the things that we're really trying to reinforce. We certainly could see the hesitancy and the concern regarding that. And the goal is also, hopefully within the next couple of weeks, to set up a call with providers by region so that I can ask so I can answer any questions that they may have regarding this process and provide that reassurance. Again, we're a subrecipient of these grant funds to improve infection prevention and control practices. And it certainly would be somewhat unfair if we turn around and cited you for things that we're supposed to be helping you to improve. I mean, that is the intent of the grant.
Well, I appreciate that. Will the department be coordinating at all? Is it possible that this training could be occurring and an assisted living also being inspected at the same time? Or will you all be coordinating those efforts?
I'm sorry, will you say that again?
Is it possible that an assisted living could be working with you all on the grant and receiving the training, but also undergoing a survey at the same time? Will you all be coordinating those efforts?
So I think there's always the potential as we're working through an infection control practices and trying to make improvements within a particular facility, that a complaint could come in separate and independent of the grant. And of course, if that's the case, we're obligated to investigate that. That being said, the data that we collect isn't going to be provided to the inspector that then could be used as part of the complaint for evidence, so to speak.
Yeah.
So, so we understand that that's a possibility that could occur, and we're trying to keep the lines separate regarding the intent of the grant and any complaints that may come in. And, the data that is going to be shared with inspectors is likely just going to be on a regional basis. So at this point, we don't have the plan that we're going to come out and do the on-site assessment and send a copy of that to the inspector. We're going to try and share information with them regionally, collectively, so that they understand what is being seen through these surveys and on-site assessments in their regions, because that could also prompt particular provider trainings as well, specific to region-specific issues.
Got it. Thank you. So some questions are coming in. Will you be providing a template for the infection control program?
In terms of the on-site assessment?
I think this question is geared at maybe policies. Will you provide a template for infection control policies?
So one of the goals is the grant is to provide a template for the infection control plan, not necessarily separate policies and procedures pertaining to other infectious and communicable diseases, but most definitely for the ALFs and the ADCs, one of the end goal is to have a model infection control plan form based on the standards, which also includes best practice. So you'll have each line item that's listed under 100 for the ALFs, for example, that standard, with a pretty thorough breakdown of what should be within each line item for that regulation. And this will be a group effort. So, we will be putting together groups. It won't be just done within a house within DSS. So we'll ask for provider assistance and set up meetings and things like that when we get to that point.
Okay, thank you. Two more questions. So we have 2 assisted livings on our campus. Can the policies be the same? Can they just submit one copy?
Or is it the same? Is it the same policy?
That person may want to clarify. We have 2.
Yes. Hi, Dana. Tracy Maynard. Yeah, we have 2 assisted livings on our campus. So a lot of our policies do mimic each other across our campus. So can we just submit one packet
So
for both assisted livings?
Right. So I would say if it's the same, if it's exactly the same, then yes, you can send one, but please note when you send it to that IPCT that it's for 2 facilities and what facilities they are.
Perfect. Thank you.
Right. And then if you have separate ones that in the other policies and procedures that may not be the same, then just send those separately.
Okay.
I put that email address in the chat box for those that need it. So the last question is, when will the on-site visits begin?
Well, we have to hire the IPCT first. So that we're working with that right now. In a perfect world, I would like to say towards the end of February, but that's, that's a lofty goal at this point, and it depends on how quickly we can get individuals hired and onboarded and trained. We're working on things like the on-site assessment tool now, the rubric that's going to be used to evaluate the infection control plans for consistency. We're trying to have all of those back of the house things that we're working on done so that when these individuals are hired, they can immediately get out in the field.
Great.
And these, of course, will be scheduled visits. That, it's not like an inspection where it's going to be unannounced. We need to partner with the facilities in this process. So we just won't show up.
Yeah, appreciate that. Well, really appreciate so much the overview. I just want to open it up and see if there are any other questions.
Well, and again, if you think of a question, you're more than welcome to send it to that IPCT email, because we are tracking questions that come in, and we are developing a frequently asked question document, because we know that individuals are gonna, have lots of questions as this process goes on. And again, my goal is within the next 2 weeks to meet with all the regions. So if you do think of more questions, you can address them there as well.
Well, thank you so much. We really appreciate, and I hope you can stay on for the remainder of our call if you'd like. We'll be talking about CMS final rule and the CDC guidance, and then talking about member needs through Omicron. So hope you can stay if you'd like.
I certainly will. Thank you very much.
Thanks so much. Okay, well, now we're going to be switching gears to talk about the CMS final rule and CDC revised guidance. Janine Fink-Boyle is with us from Leading Age National. Thank you so much for being with us today. So over to you, Janine.
Thank you, Dana. Good morning, everybody in Virginia. I hope you're staying warm and waiting for the next wave of ice, snow, or whatever comes our way. But as we know, the administration was pretty busy through the Christmas and New Year's holidays and is still churning out new and updated guidance and revisions. And I do want to start with something that I got this morning, and I'm hoping that a lot of you got it in your inboxes. But yep, tomorrow, CMS and CDC are going to hold a stakeholder call, and it'll be hosted by Administrator Brooks LaShore, but there will be both CMS and CDC officials on there. And they will actually be discussing the CDC guidance and the CMS vaccine mandate for obviously the 25 states that it applies to right now. So I am going to pop in the chat the Zoom registration. You need to register by 5 p.m. tonight. Hoping this will work. There we go. And make sure that you get in there, and then just check. I know everyone does this, but just a reminder, if you don't see your registration confirmation come in your email, to check your spam filter, because I did it quickly this morning and it came right to my regular inbox, but I do know it goes to spam. But please make sure that you can sign on to that tomorrow. I don't think there'll be any new announcements, but I think that they will go over what has already been released through the 23rd and then the 28th of December. So I'm going to start with the vaccine mandate guidance. And so as we know, we had the interim final rule was published in the beginning of November. There's been a lot of back and forth. And I think if you've heard Corey Kalheim on our 3:30 calls on Monday and Wednesday, he's been talking about the two Supreme Court circuits, the circuit, the 5th and the 8th courts that have holds right now. And however, what's come forward, we're waiting for January 7th, which will be Friday, which will be the Supreme Court hearings. But in the meantime, CMS has put forth guidance that's applying to 25 states, which Virginia is one of them. And the 25 states it doesn't apply to, I just put on here. So this is guidance. It came through a memo. The memo is an all memo. And I say that specifically because when you go into the memo, you then need to go into the attachment, because the interim final rule, if you remember, was not just for nursing homes, also for home health, for hospice, for critical access hospitals and hospitals and surge. So all Medicare certified providers. And so there are attachments specific to your provider type that you then need to look at for the guidance on how the surveyors will survey, as well as the enforcement actions and timeframes. So I put the memo here, but as I said, we're going to go through the specifics for nursing homes. So Dana, if I can have the next slide, and we can just leave this slide, the next slide up, that would be great. So as we know, the CMS interim final rule, as I said, applies to about 16 to 18 different provider types. When the rule was put forth for, let's go step back. When the rule was put forth for everyone, there were 2 phases. As we come now, after some of the start and stops, we are now again with a 2-phased approach for compliance. So the first phase date, which you need to mark on your calendar, is January 27th of 2022. And the second phase is February 28th of 2022. These 2 dates actually coincide to how you need to have your percentages of your staff vaccinated. And remember, staff vaccinated, in the attachments, there are definitions. The staff that need to be vaccinated in your organizations are ones that include individuals who are providing care or services to your facility, to your organization, obviously to your residents. So it doesn't apply to individuals that remote work or telework or provide services entirely remotely. So it's individuals that are interacting, that are in your organization. The definition or the explanation in the guidance memo fits right in with the interim final rule. It talks about if there was an inspector for an elevator and they come in once every quarter, that person you wouldn't need to have in your numbers or in your tracking tool sheet, but someone like the pharmacy consultant would be an individual, any students or volunteers, any licensed practitioners. So whether you have PAs or NPs, your MDs, someone specifically that might be doing obviously rehab or respiratory therapy. So again, any individual providing care, treatment, or services under contract or management also. So again, that's why I kind of talked about pharmacy or respiratory or rehab. So you may have medical or religious exemptions, and that we'll talk about that in a second, but that is part of the guidance. And obviously you have a policy and procedure. So the main areas that we're going to focus in on that come through the guidance work through policies and procedures. So obviously that's documentation and tracking, having a tool, being able to show where your staff is working and if they've been vaccinated, and obviously what are the percentages of your organization. And then if you're not at that 100%, what is the plan to achieve compliance? And so knowing that there are lots of organizations that are close to 100% or at 100%, again, with medical and religious exemptions. But there are still, we know there are still organizations that haven't gotten there yet that are working towards it. The January 27th date, which is phase 1, that is where your staff need to have their first dose. That needs to be documented. That's the single dose or the first dose of the 2 series. And just to be pretty clear, in the guidance, it explains what a fully vaccinated individual is, and that is the single dose or the 2 doses of a multi-dose vaccine. It does not include boosters at this time. And I say that because I think the more and more that we've heard about boosters, if you look at the CDC guidance that was released at the end of the year, boosters are part of some of the return to work contingency planning. And so with that, we think that's coming, but as of right now, it's not in the guidance. So with phase 1, if your organization is not at 100% of your staff vaccinated, you need to be above 80% in order to avoid enforcement actions. But with that 80%, you need to have a plan of compliance to get to 100%. So that's at the January 27th. That 100% of compliance plan needs to show within 60 days. So you're working today, you still have some staff that haven't been vaccinated. They need their first dose by January 27th. And you then, if you're again above the 80% of staff and you're not at 100%, you need to have that plan. So as we get to phase 2, which is February 28th, your organization is working towards that. That is where your second dose of the multi-dose series needs to be completed for your staff members. you need to obviously be at the 100% of your staff complete. However, there's also a piece in here, just like in phase one, you have a above 90% completion. So if that's what your percentages is, then what you can do is make sure that you have a plan within 30 days to become compliant and achieve 100%. So that's kind of where the bulk of this guidance is for nursing homes. Now, it's also the same date range for home health and hospice. And so when we're looking at our membership as a whole, we know that the date ranges are the same. There's some different documentation for hospice. But again, when you're looking at making sure that you have that mark on your calendar, these are the dates that you need to use. When you go into the next part of the guidance and it talks about compliance and how will the surveyors come in and actually survey, it will be during a standard or a complaint survey. So it's not going to be a separate survey to come in and do vaccine investigation. It will be at the time, mostly right now, your standard survey could be 9 or 8 months from now with that. And it will be what we heard yesterday on our association's small call with CMS. The question was asked, is it a point in time? And it is a point in time. So knowing that these are the phases and in everyone's good faith effort, you will meet these phases to become 100% staff compliant with the vaccine mandate. But you know that when you are going to be surveyed, maybe in August, it will be that point in time. What the surveyors are looking for is they're looking for your documentation, your policies and procedures. They're looking at your tracking tool. They want to see to make sure that your vaccination status is on there, that you have your staff members listed, that you have their assigned role, what areas they work in, and how they interact with residents. So whether you use a spreadsheet, whether you have a particular tool that you use that we have put forth, and I'm going to talk a little bit about that in a second. But again, or if it's something that you're using from another organization, the colleague that you've been working with, but you need to have a tool. So when the surveyors come on site, the first thing that they're going to have is they're going to have your NHSN data. Now they know, and they're very open to the fact that that NHSN data is a lag behind and doesn't include religious exemptions. However, they will have a percentage from NHSN of your staff vaccination rates, which is what is out there right now. Now, what they're looking for is that when you present the data on site with your tracking tool, they're looking for the percentage that is there. And what they're doing is they're going to compare the two. So if there is a huge discrepancy, and CMS is pretty clear and was adamant yesterday that they don't expect to see a very large discrepancy, but they're looking for it to be under 10% difference. Thinking about the lag time, if you have maybe new employees that you're not fully vaccinated yet, but they have that one dose. But if they see that those percentages are very close and under the 10%, then they're not going to dig any deeper. But if there's a very distinct difference in the percentages, then they're going to start to really looking at your policies and procedures, really digging in, asking questions, checking the documentation, because they're pretty confident that there shouldn't be a huge discrepancy between NHSN and when they come on site. So thinking about tracking and securely documenting, as I said before, making sure that you have the status of all of your staff. Again, if there are temporary delayed vaccinations or you have your medical or religious exemptions, they're going to ask for a list of those individuals with exemptions. They're going to ask to see the documentation and how it was met. So obviously your policies and procedures, if there's any contraindications. So again, with CDC, so those medical exemptions, there might not be many of those, but again, how was that process put forth, and then how did you document it? You need to make sure that if your staff is getting boosters, and I hope that they are, that you also are tracking that. They're going to ask for that information. Again, not part of fully vaccinated at this point in time, but that is part of the guidance memo. You do need to have contingency plans. So meaning that is that if you have a staff that hasn't been vaccinated, that they're working on their maybe 2-dose series, that they are working in non-patient areas and duties. your masks, and making sure that there's some physical distancing. And then with that, obviously weekly testing. Now, I know this is going to dovetail into what your state is asking to be doing if you have staff that aren't vaccinated. Again, I want to go back to the documentation, because as all of this is put into place, the survey team is going to be surveying with a brand new F tag. So as we've gone through new F tags in the last almost 2 years of the pandemic, we have a new F tag, which is F888. That is the COVID-19 vaccination of facility staff. So that is a citation you would receive in the memo. And I'm not going to bore everybody, because I know everyone loves to read about scope and severity. But in the memo, it goes through where you would be cited, how you could be cited for an immediate jeopardy, looking at a combination of the if you have infection, if you have an outbreak, there's 3 or more, if there was any particular deaths. But then it goes from obviously level 4, severity 4, scope and severity at immediate jeopardy, all the way to what we would consider as a level 1, which could be a documentation error. But again, this falls under F888. Now, it doesn't mean that it can't be cross-tagged. I know everyone hates to use that word, and we know that that's not always done, but it could be. Using the on-site survey with the off-site survey prep from NHSN. The survey team will have a new matrix, or an updated matrix, I should see. And that is with the infection prevention, control, and immunization facility task. So if you know, when they've come in and done the focused infection control surveys, they're using this, what we call the critical element pathways. It will be updated to include vaccinations. CMS said yesterday they expect that in about 2 weeks to be updated. And again, it's something that you'll be able to use to be able to do mock surveys. A couple things that we heard yesterday from CMS, and specifically, I just want to be pretty clear. Some questions they won't answer, obviously, from states that are not part of the enforcement right now. And because they're still under, waiting for the case to be heard. They do expect, and this is pretty clear yesterday, that non-enjoined states will become compliant. That is what they're saying out loud. I'm expecting maybe we'll hear that tomorrow also. They're focusing on whether your staff received the vaccine, not that 2-week waiting period. They're just that your staff is officially fully vaccinated. And that a fully vaccinated, again, means the 1 shot of J&J or the multi-dose of Pfizer or Moderna. As I said, the matrix will be released probably in the next 2 weeks. The exemptions, and I'm just looking at my notes from yesterday because I don't have this committed down yet, but the exemptions will be looked at by surveyors. As I said, they're going to be asked for a list of exemptions, so both approved and pending exemptions. They don't expect, as I said, a huge number of health exemptions, but NHSN doesn't take the religious exemptions, so they're going to want to see those on site. They won't count the exemptions through the survey process. They will make sure that your policy and procedure, again, is in place for that. We brought up yesterday that there's a lot of confusion still over the definition of staff. So I gave you what is in the memo. We asked yesterday for a FAQ and a little bit more direction on the definition of staff. They said they would take that under advisement and maybe go back and come out with an FAQ like they did with visitation at the end of the year. I'm hoping everybody saw that FAQ, which I think was helpful to give nursing homes flexibility about visitation and with outbreaks currently. And so, other pieces is that CMS is really urging for your staff and residents and their families to get boosters, and making sure that if you have access to monoclonal antibodies, if you're having any difficulty with getting those treatments, they want to make sure that those are available. We did bring up, I do want to say this, we brought up that we know that there's a lot of organizations that are not receiving the Binax Now tests in accordance to how they were receiving them before. We brought that forward, and they're working on hopefully making sure that that will come back to the numbers that have been allocated in the past. That's kind of everything with the vaccine mandate. I know there's probably we'll have it in a recorded version that you could play for your teams. And I hopefully will have that done by tomorrow and should be released by the end of the week. I have the updated policies and procedures for both visitation and vaccine with the toolkits that we've been working on for the last obviously couple months. Those should be released also tomorrow. Remember, those are on our coronavirus section of our leadingage.org website, not behind the member wall. And those will have all the updates that we just went through here and all of the updates with obviously with visitation, with the flexibility. Now, with CDC, we know that CDC released general public guidance right before Christmas. And that was general public guidance. It was not for healthcare personnel. After Christmas, right before New Year's, they released healthcare return to work guidance. And I think, Dana, I didn't know if you popped that in the chart, if in the chat box, I'm sorry, if you could, or if not, I can do it. But I think that the chart that's on the webpage for CDC is a great chart to be able to follow. There's some changes with the return to work, looking at whether someone actually had COVID versus whether they've been exposed and are asymptomatic, excuse me. Looking at if they're vaccinated and vaccinated with a booster. This gives a lot more availability in the ability for having your normal conventional staffing. If you are in a contingency staffing need or you're in a crisis, it gives you more ability to bring people back in a quicker time frame, obviously, especially if they're asymptomatic. So looking really, and I'm just going to make sure that I have everything together here. Your workers who are asymptomatic can return to work after 7 days if they receive a negative COVID test. And then again, as I said, if you are having shortages, you look at the contingency and the crisis part of the grid, and it can bring you to 5 days with or without a negative test if they're asymptomatic. And there's no work restrictions, obviously under crisis. I know this can be a little bit confusing. Again, that's if people have had COVID, if they've been exposed and then they've been boosted and they've been vaccinated. If they've been boosted, there's no work restrictions, but again, a negative test on days 2 and 5 and 7. If you're in contingency, and again, remember always being able to document, and I want to say the word prove that, why you're in the contingency, no work restrictions. But really when you're looking at what the CDC put into place, if the return really considers factors such as symptomology, vaccine status, and staffing capacity. Really looking forward to making sure that you're able to get people back as little, hopefully under 5 days. Asymptomatic exposure, you have your booster, you're permitted to work without restrictions under all staffing capacities. As I said, I think there's been a lot of questions about the changes that we keep hearing and again, with CDC, but we've been pretty clear, and I do have it under documentation from CDC in an email that healthcare personnel needs to follow the healthcare personnel guidance, not the general public guidance. The one caveat I will say is that the part about residents, that has not been updated, and they are still to follow the September guidance for residents. And I know that I can make sure that the wording that was sent from CDC, I can make sure that you have a copy of that. But that's pretty much everything that I have. I hope that I was able to clear up or put people in the direction of where you need to be compliant for the vaccine mandate. There's a lot of moving parts. I think if you've heard, as I said before, Corey talking about not just the mandate for vaccines, but the OSHA and what was removed from OSHA, but what is still in play for documentation, and what changes could possibly happen there. Excuse me. And I know that it's a lot, and I'm hoping that we're able to keep bringing you the most up-to-date information that we can. We'll have a call this afternoon at 3:30 if you're able to be on it, or remember it's always recorded, so you can listen to it after. So that's everything from me. Dana, back to you.
Thanks, Janine. Appreciate that so much. You've had a couple things come in. One person said we had a fine given because we were a couple days late submitting our NHSN vaccine information, even though we have a history of doing this nearly every week. Is there anything we should do, or should we just pay the fine?
So here's a couple things I will tell you. They're pretty black and white. If you miss the date, obviously you got a fine. I would say that I think there's an appeal process in there. And if there was a reason, this is what we've been told from CMS, if there was a reason that you were late, like the internet was out, it's been documented, you were on downtime procedures, what they're not going to accept is that if someone was out ill or on vacation, because you should have a backup and a backup to your backup. So I would leave you with that. That's what we've heard in the past. If you have very strong documentation of why you were late or didn't submit at the time, and those are the experiences that was given to me. So I would take that into maybe then talk to your legal counsel and see what would be the best.
Thanks, Janine. One other comment. The large discrepancies when reporting in NHSN could show when you have students that are on site that we are to report. Then they're no longer here, they drop off. NHSN will show a warning. I can't see the whole message that there is a percentage difference.
Yeah. So, as I said, we did bring up a lot yesterday about the discrepancy. It could be, they're looking for the fact that if they come on site and there's such a large discrepancy, you can show why there is a discrepancy. So again, always going back to the documentation, and remember, it's going to be that point in time from when they come into survey. I think that and I will be honest with all of you, I think that they really need to go out and do some surveys and see what is coming up before there potentially could be any sort of other guidance or changes. But I would just say, as long as you can show them what the documentation is, why there is such a discrepancy, then you can avoid, hopefully, a citation or any enforcement action.
Well, thank you so much, Janine. We really appreciate you taking the time to talk with us and all that you're doing for us at Leading Age National. We know that
No
you
problem.
were on the holiday, so sorry about that.
No, that's okay. But I also just want to say is, please feel free to send me an email. If you have a question, if and I can come back and speak again, whatever you might need, or if there's a question I don't have an answer, I sent a few today to CMS and CDC. So that's what we're here for. And if you want to, also Jody's on vacation. So I know that you see Jody a lot too, but she's on vacation, well-deserved vacation. So just send things to me right now. She'll be back in a little bit. So
Okay.
Great.
Well, thanks so much. Thank you. So we are going to move on to the Omicron discussion for member needs. We have JC Hearn with the Virginia Department of Health, which we've been talking with over the holiday to communicate member needs. And we thought this would be a great opportunity for this to further this discussion. So over to you, JC.
Thank you, Dana. I appreciate the time today, and Happy New Year, everyone on the call. I'm glad to be with you today. My goals today for participation is to really gather feedback from you, from the members of Leading Age, to help us determine what's needed, what sorts of guidance, frequently asked questions and things like that we can put together to be able to help you do your jobs and to respond to this surge in COVID cases as a result of Omicron. So our team at VDH has been very busy over the last 2 weeks trying to gather information, distill information, collect information on needs from organizations and agencies across the state. And we've been working a lot with the associations to be able to gather that information in an efficient manner. One of the things that we are considering and would like your feedback on is whether or not there's a need for a webinar to review this updated information and talk about resources and things that may be available for or not available for long-term cares in meeting their needs. We do plan to disseminate information widely via email and to the associations, but I'm curious about the need for a webinar. I know we have lots of meetings and webinars already, so that would be my first question to you is there a need for that, or is written documentation communication sufficient?
So basically, you're asking if we need to pull together again to review all the current guidance as pertaining to Virginia providers.
Yes, that and any frequently asked questions documents or other guidance documents that may be created or updated in regard to the updated CDC guidance.
We have comments coming in that are saying yes. My only feedback would be that I think that we would need to make sure that if you want to do all long-term care providers, or do you want to break them up into levels of care? Because depending on, there are some questions that were coming in directly to me related to adult day, asking if they were applicable to some of the things we were discussing. So I'm getting lots of yeses. So I think that would be great.
Yes, thank you for all the comments in the chat. And also thank you, Dana, for that suggestion about considering tailoring it to the various types of providers so that we make sure we're sharing the most important and appropriate information. And then also making efficient use of everyone's time as well.
And as far as other type of feedback during Omicron, are you looking to hear issues about testing, staffing? What other types? I mean, staffing is a major concern. What other types of things are you looking to get feedback on?
So some of the feedback that we have gotten, obviously we know there's some staffing issues and we've been encountering challenges with testing availability. We've heard about those, but we're also hearing from some that there may be challenges with fit testing, having people who are trained to fit test, getting supplies. So in addition to challenges with staffing and obtaining testing supplies, which we know about, are you encountering other challenges like obtaining supplies that you need, or fit testing equipment, fit testers, training for people to be fit testers? Let's see, any challenges with obtaining monoclonal antibodies if you're looking for that? So above and beyond just staffing and testing needs, really.
Okay, well, I would definitely open that up. Either come off mute or put your issues and comments in the chat box. Now, if anyone does have anything that they wanted to relay following this, should they reach out to you directly?
So we would prefer, Dana, that the associations
Sure.
collect the information for us after today. I'm going to take some notes on the feedback that I get today, but the most efficient way for us is if the associations will collect and collate that information and then share it with Sarah.
Okay.
And Andrea may be able to put a email address for us in the chat. They may prefer that it go directly to their HI. She just did to the HAI general email box so that they can collaborate and collect all the information there first.
Okay, great. Well, I just want to encourage everyone to address your concerns and needs now. This is a great opportunity. Well, getting silence, JC. Maybe everyone just needs a little more time to think about it. Okay, well, we appreciate your willingness to come on and talk with us about some of the areas that we're needing assistance in right now. So we will definitely continue to follow up with you all as we receive those. So that information can be sent to me, and I can share that with JC at the Department of Health. So we have 5 minutes remaining. So I'm not seeing anything in the chat box. Oh, have any questions that have arisen immediately regarding the updated isolation quarantine guidance for healthcare personnel? So have you all gotten any specific questions about that? JC.
So that was Andrea that had put that in the
Oh.
chat. So I think she's asking,
Oh, I'm sorry.
have any questions arisen?
Apologize. Yes. Any questions out for our membership related to that?
I know we've gotten some related to clarification of certain things. So we are working on some FAQs that will
Okay.
be sent out hopefully soon.
Okay.
I suspect it will be sent out like the information earlier, I think last week, where it went to the COVID task force and the associations to share with their membership.
Okay. Well, not getting any questions at this time, but we may later. So we appreciate, oh, here, obtaining rapid tests N95s are becoming more and more challenging. Is anything the state can do?
So I will record that, and I can tell you what we know currently, especially about the rapid test, is that we're trying to work with our testing team to determine what's available and get more information back from them to help support that. But at this time, I don't think that they have provided our group with any updates related to testing supplies. And I haven't heard anything about N95s, but Andrea may have in some of her conversations directly with the regional IPs. So I will note both of those questions and we'll take those back to the group.
Okay, well, I just want to encourage everyone as you run into needs, please send those on to me and I will get those to the Department of Health. We appreciate you being on today, JC, to take our concerns. So I want to thank everybody for being on today. This PowerPoint and recording will be in our newsletter tomorrow. So hope you have a great week and thanks for being on. Oh, there is a reminder that the Department of Social Services has an emergency supply of PPE for assisted living. Those assisted livings can submit those needs directly to their inspector. Good to know. Thank you, Lee.